Hello, all. We will let folks hop on, and then we'll get started. Seeing a quorum, I'll go ahead and get us started. Good afternoon. Thank you all for joining today as we discuss how Republicans are hijacking important healthcare negotiations to impose dangerous new abortion restrictions nationwide. We have a great group joining us today, including Reproductive Freedom Caucus Chair Representative Diana DeGette from Colorado's First District, Jessica Schubel, from founder of Day One Strategies and former Special Assistant to President Biden for Healthcare, and Dr. Kristin Lyerly, an OBGYN from Wisconsin, who is an active advocate in her community. Instead of addressing soaring healthcare costs that threaten millions of American families, Republican lawmakers are catering to anti-abortion extremists and spreading misinformation about abortion coverage under the ACA. The reality is that millions of working families are facing higher premiums and could lose healthcare coverage entirely because Republicans want to keep their extremist allies happy. But let's make no mistake, the same people who claim that abortion should be left up to the states are pulling every lever they can to ban abortion nationwide, even though it's deeply unpopular with most Americans. And with all that being said, I want to go ahead and pass the mic to the Congresswoman to kick us off.
Thank you so much, and thank you for convening us here today. This really is an urgent situation and one that we need everybody to know about and to talk about. When Congress passed what I call the big bad bill, HR 1, last summer, the House Republicans tried to put a rider into the bill that we last saw when we did the Affordable Care Act back in 2009, 2010, that would prevent people from who are on insurance exchanges from buying insurance policies that covered abortion, even with their own money. And back at the time, I was the vice chair of the Energy and Commerce Committee, the chair of the Reproductive Freedom Caucus. And we were able to strip that language out of the ACA when we first passed it, and here it rears its ugly head again. Most recently, we are hearing House Republicans say that in any end of the year healthcare package they might do, they might once again try to ban insurance policies that offer abortion policies or not to offer abortion policies as part of their policies in the exchanges. Make no mistake about it, this kind of legislation would be the greatest expansion of abortion reductions and prohibitions in our lifetime. The reason is this: the Hyde Amendment prohibits people prohibits the federal government from paying for abortions. But this is much, much farther beyond. By the way, I think we should get rid of the Hyde Amendment. But what this does is it says people in these exchanges who are buying insurance policies with their own money cannot buy a policy that offers abortion services. Back when we passed the ACA, this was the same situation, and it's a vast expansion of abortion restrictions because it says now that people cannot buy these policies with their own money. But just to make sure, when we did the ACA, we had language in the ACA that clarified no federal funds will be spent on abortions in the ACA. The secret, the secret goal of this provision is to stop allowing insurance plans at all from covering abortions. Now, this is a huge expansion of abortion restrictions nationwide. It will stop people from getting the essential medical services that they need. We have to sound the alarm right now, and we have to say, not on our watch. A majority of Americans, after the Dobbs decision, now understand why it's so important to have abortion as included as an essential service. And we can't go back. We need to go forward. And so that's why we're here today. And that's why I'm so happy to have two of my wonderful allies in this fight with me. And so I guess I'm going to turn it over right now to Jessica Schubel, who can talk to it. She's the founder of Day One Strategies, and she was the former special assistant to President Biden for healthcare, and she can talk to us much more about the details of these terrible provisions.
Thank you so much, Congresswoman, and thank you to everyone for joining us today. I got into the healthcare business because I believe everyone should be able to get the healthcare they need without going bankrupt. I spent 4 years at the White House doing everything I could possibly do to make sure people could sign up for coverage and enroll in affordable healthcare. I am so proud of the work that my colleagues and I did during our time together in the Biden administration. That's because more Americans had health insurance than at any point in our nation's history while we were in the White House. But that's all at risk. That's because the Republican healthcare agenda is focused on making it as hard as possible for people to get, keep, and use their healthcare. From approving the largest cuts to Medicaid and the ACA ever in either of the history of these programs, to creating new roadblocks for people to easily sign up for coverage, that's the name of their game. So, how are they doing it? They're holding the ACA subsidies hostage by peddling lies. They need to get their facts right. No federal money pays for abortion coverage. That's the law, plain and simple. Some states allow for abortion coverage to be included in ACA health plans. It's health care, after all, but people pay for it separately. What the Republicans are trying to do here is use abortion to justify taking health care coverage away from millions of people. The enhanced ACA subsidies that are expiring in just over a month are why so many people signed up for ACA coverage. These subsidies made health care affordable. Without these subsidies, premiums are skyrocketing. We're already seeing this play out. On November 1st, 22 million people who buy their own coverage on the ACA marketplaces saw their premiums skyrocket as much as $1,000 a year. That's about $85 a month. In fact, as a small business owner myself, I buy my own ACA coverage, and my premium is going up over $100 a month starting in January. When you put that in context with everything else that's increasing in prices, from groceries to electricity to housing costs, what are people going to do? With high costs like these, people are going to have to make tough choices about what fits in their budget. And the biggest budget buster is healthcare. People are simply going to go without. They're going to roll the dice and hope they don't get sick, break an arm, or get into an accident. And don't be fooled by President Trump's latest healthcare idea, quote unquote idea, which is giving money directly to Americans to put into a healthcare savings account. While this may sound good on paper, it's a terrible deal for hardworking Americans. What we need are good faith negotiations. People deserve affordable healthcare. Republicans shouldn't be holding this hostage over an issue they're simply making up. No federal money goes to abortion coverage. Republicans should focus on lowering healthcare costs, not kicking people off coverage. People across this country deserve a healthcare system that is both affordable and accessible. And with that, I'll turn it to Dr. Lyerly.
Thank you, Jessica. And I too am on the ACA. So this is personal and professional for us. But that's not the reason that I'm here today. I'm a board certified obstetrician gynecologist in Wisconsin. I spent my entire career taking care of pregnant patients, delivering babies, managing everything from routine annual exams to life-threatening complications. And I am here today to tell you that something Republicans don't want you to know. Their attacks on abortion aren't just about abortion. They are dismantling the entire foundation of healthcare in this country, especially reproductive healthcare, and we are all paying the price. Let me explain how this actually works on the ground. When politicians pass abortion restrictions, they sell it to us like they're passing a single issue law, but medicine doesn't work that way. Miscarriage care is abortion care. The medical name for a miscarriage is a spontaneous abortion. We use exactly the same medications and the same procedures to treat each of these conditions. So when you restrict abortion, you don't just affect people who are seeking to end their pregnancies, you affect every person who walks into an emergency room bleeding from a miscarriage. And that is a very common problem. I've heard from many colleagues all across the country whose hospital legal teams now review miscarriage cases before allowing treatment. And I've been in similar situations myself. Imagine that. You are hemorrhaging, and we are waiting for lawyers to tell us if we're allowed to provide medical care and save your life. That's not medicine. That is politically induced administrative malpractice. And it actually gets worse. Those same medications that we use for abortion and miscarriage, medications like methotrexate and misoprostol, they treat arthritis, lupus, ulcers, and pregnancy complications too. But now pharmacies are refusing to fill these prescriptions because they're afraid of abortion laws. So patients with chronic diseases who've never been pregnant in their lives are being denied care because politicians passed laws that they didn't understand, and we have to live with the consequences. The ripple effects go even further. In Maine right now, clinics that provided primary care, treating sexually transmitted infections, bronchitis, tick bites, all of that kind of stuff, these clinics are being forced to cut back services and lay off staff. Why? Because they also provided abortion care, and new federal policies excluded them from Medicaid. These weren't abortion clinics, they were community health centers. But in places like this, where some of our most vulnerable neighbors receive their care, when you defund abortion providers, you don't just take away abortion, you take away everything. And here's what really keeps me up at night. Doctors are leaving. OBGYNs are choosing not to practice in states with abortion bans because we're exhausted and we're afraid of being prosecuted for doing our jobs and taking care of our patients. Just today, I talked with a colleague doing critical work in a very red state who's had enough. She's leaving. Idaho has lost over a quarter of their OBGYNs in the past few years. There's already a profound physician shortage, especially in rural areas, and it's only getting worse. I went to medical school for 4 years. I completed 4 years of residency training. I maintain board certification with continuing education every year and skills training on a constant basis. And yet, politicians who think they know the difference between a placenta and a pancreas, but they don't, they think they're qualified to override my medical judgment in the exam room when I'm taking care of you. They're not. These laws force impossible choices. Medicine requires nuance. Every pregnancy, every patient is different. But politicians write laws with rigid language, like life of the mother, exceptions that sound reasonable until you realize by the time a patient is dying enough to qualify, it may be too late. And even if we can save their lives, can we reverse the damage that's already been done if they've had a stroke or a heart attack? We're watching patients deteriorate, waiting until they're sick enough that lawyers will let us treat them. These are the situations we're trained to avoid. And that's how we save lives, preventing predictable things from happening, not waiting until it's almost too late. And then there's the disinformation campaign. You've probably heard claims that medication abortion contaminates water supplies or causes infertility. Let me be absolutely clear. These are lies, complete fabrications. Mifepristone has been used safely for over 20 years. It's been studied extensively. It's safer than penicillin, and it's much safer than Viagra. And the evidence is overwhelming. It does not contaminate water. It does not cause infertility. It does not increase cancer risk. But here's the thing. This disinformation is working exactly as intended. My patients and my colleagues are so confused by conflicting and changing information that many don't even know that medication abortion is still legal in their state. A smart and engaged colleague asked me just today if abortion was legal in Wisconsin. It is, but it hasn't been, and then it is again. It's very confusing. Patients are too afraid to seek care, even for miscarriages, because they've heard that they could be prosecuted. When Republicans spread lies like this, they don't face the consequences, but my patients do. Women are showing up to emergency rooms sick, hemorrhaging, septic, because they were too afraid to seek care earlier. And let's be honest about what's happening here. If this were really about protecting life, we would see investment in maternal health care, not a tax on it. The United States already has the worst maternal mortality rate in the developed world, and it's gotten worse since Dobbs, particularly for women of color. That's not pro-life. It's literally deadly. Every physician takes an oath to do no harm. These laws are forcing us to do harm. They're forcing us to watch patients deteriorate. They're forcing us to provide substandard care. And we're helpless. So here's what I need you to understand. I trust my patients to make their own healthcare decisions in consultation with their healthcare providers. Politicians, Republicans need to get out of the exam room and let doctors practice medicine because this isn't theoretical. This is happening right now, and lives are on the line. Handing it back to you, Malachi.
Thank you so much, everyone, for your statements and for your strong sentiments. At the end of the day, so much is at stake as abortion bans are continuing to be enforced across the country, and many people's lives are being lost in the process. I want to make sure that we get to some questions that were sent to me, and one of them is actually very timely, about the Trump administration supposedly supposed to roll out a healthcare plan today, but seems to now be on hold due to infighting regarding how to execute their extreme agenda. So, what do you guys hypothetically expect to be in this plan? And if there's even a concrete plan at all, and how do you think it will impact women, patients, and providers nationwide?
Well, I'll get started because I've been dealing with the alleged Republican alternative plans to the ACA, as I said, for 15 years. And if you'll recall, Donald Trump said that he had a plan in 2017 when he ran for president. He never came up with a plan. They said they had a plan now this time, and they didn't come up with a plan. And the reason is because you have to have a very comprehensive plan, including what we have now, which is the exchanges that allows people to buy into that at an affordable price so that they can have the health insurance that they need. And the Republicans have never been able to come up with a real alternative to that. Jessica talked about this false idea that they have to just send people some money, but for many Americans, just sending them some money, that's not going to help them pay the premiums. If the premium tax credits go away at the end of the year, as we expect, it's not going to help them pay for their deductibles and their copays. And it's certainly not going to help people who don't have health insurance because they can't afford it if they get sick. And so that's been the problem from day one, is the Republicans simply can't come up with a plan. I wasn't really surprised when they didn't unveil it today. And believe you me, as somebody who, I'm the ranking Democrat on the health subcommittee. I hope I'll be the chair of that committee next year, and we can address issues like access and affordability. But I've been deeply steeped in healthcare policy, as have my two co-panelists for decades now. And I will tell you, I wasn't surprised at all because they just can't come up with anything. Anything they'll come up with is going to take millions of people off of healthcare. Just as the big bad bill I mentioned before, it's estimated that 10 million people will lose their health insurance because of the Medicaid cuts in that bill. And it's estimated that if the premium tax credits expire at the end of December, 5 million more people will lose their health care. That's 15 million people right there, not even counting what they might try to do. One thing I think all of us can be certain of, though, is if they can, the Republicans will try to put additional abortion restrictions onto anything they do at the end of the year. That's what they want to do. That's what their base wants them to do. And as you said at the beginning, Malachi, they said they want this to go to the states, but actually what they want is an abortion ban nationally, and we have to take that seriously, and we have to continue to fight against it.
And I would just add if I can take 30 seconds, Malachi, you can wave me off if not. But just to underscore what I said at the top, the Republicans' healthcare agenda is to make it as hard as possible for people to afford healthcare. And as the Congresswoman was talking, I pulled up the report from MS Now that broke this news. And this quote, I think, just underscores the point I'm trying to make with the Republican healthcare agenda. I wasn't expecting the proposal to be Obamacare Light, a conservative House Republican who requested anonymity to discuss the yet to be released plan. Absolutely not supportive of extending ACA subsidies. That means he isn't, I shouldn't say he, but they are supportive of raising healthcare costs for over 22 million people. That makes absolute no sense. And just again, to underscore, they are just trying to do as much as they can to make it as unaffordable and as hard as possible to access healthcare.
Thank you both so much. Dr. Lyerly, did you want to add to that as well?
I'll just briefly add that 40% of our OBGYN, OB patients, obstetrical patients in this country are covered by Medicaid. And I just think about what happens to these people. What happens to the underinsured people who now are going to go without health care and show up having not received, a quarter of people don't even receive prenatal health care in the first trimester because they can't afford it. What happens to these people who show up later in their pregnancies and they're sick? They've got problems, they need additional care. But we are just going to see sicker moms with worse outcomes that will end up costing every single one of us more. Because when people don't have health care and they can't get preventive care and they can't diagnose and treat things early, they show up later on and incur greater costs that they also can't afford. And who ends up paying for that? All of us do, with higher prices, higher costs. And in rural areas where people can afford less and have less access, the impact is even greater. This is not even a concept of a plan. It's just a non-starter.
Who knew it was so complicated, right? Sorry, I couldn't resist.
No, please. I think this is a great addition to the conversation today. I want to invite anybody else to answer any or send in any more questions. Seeing none, thank you all so much for joining us today. This is an important conversation that does not need to end here, especially as Republicans continue to have jumbled priorities about what the American people need. We will be able to get in touch with folks as a follow-up, and press can look forward to a post-release from our team highlighting these ladies and what they shared today. Thank you all so much, and please have a
Thank you so much for convening us.
Thank you,
absolutely.
Malachi. Thank you, friends.
And happy Thanksgiving to all.